UC Hospital is a growing presence in the St. Louis hospital landscape. It is just one of many healthcare facilities helping thousands daily. In fact, the healthcare industry in Missouri is adding more jobs every year and is expected to grow by double digits over the next 15 years. Despite this, many rural healthcare providers are still struggling to stay solvent. Missouri Capitol Bureau Chief Joe McLean is looking into the state's changing healthcare landscape.
We're seeing growth in that all across the spectrum, yet we're seeing rural hospitals close. One in Fulton, Mexico, 10 a number of years back. I mean, this is something Scotland County hanging by a thread.
State Representative Lewis Riggs, a Hannibal Republican, asking last week about the disparity between a growing healthcare industry and shrinking rural access. For example, Riggs mentioned Scotland County Hospital and Clinics. Like many rural healthcare facilities, it's losing money each year, running about a 13% deficit. Heidi Lucas knows this trend all too well as leader of the Missouri Rural Health Association.
The reimbursement rates are abysmal, particularly whenever you're talking about the Medicare Advantage plans. They tend to not have the reimbursement levels that they had claimed to have. The denial rates are sky high, and this causes problems.
Anastasia Tiedemann leads the Missouri Rural Enterprise and Innovation Center and said while Missouri's healthcare industry is growing in sophistication, technology, and research,
what is sadly not growing is rural access. We do see our rural hospitals struggle. Our rural healthcare systems are struggling. So I don't think that the growth necessarily reflected both sides of that story.
It's actually easier to list the places that aren't seeing a county-wide shortage of medical workers in Missouri. The lightest blue-shaded counties just outside Kansas City, Clay, Cass, and Platte, are the only ones that aren't seeing a shortage. Lucas said if a solution isn't found soon,
we're going to lose more hospitals. Unless something is figured out, we're going to lose more hospitals and care providers in our rural communities. So, and a lot of the times, the hospitals are kind of the linchpin to a community.
Missouri currently has 23 rural hospitals that are running negative deficits and 17 more that have margins within 5%. In Jefferson City, Joe McLean, First Alert 4.